Hi, this is Sarah Druck, and welcome to my final Teaching Strategies project. This presentation is based on cognitive learning and constructivist learning theories, as one concept will be built upon the next. The chosen teaching strategies utilized will include concept mapping and case-based learning. The concept map will be expected to be completed prior to the beginning of the class so that students may build upon knowledge, and the case study will be presented at the end of the class and to be finished up within the discussion board to help cement the class teaching and allow students time to utilize their critical thinking skills. Here is my presentation on the gallbladder. The objectives of this course. By the end of this lesson, the student will be able to explain where the gallbladder is and its main function, state the signs and symptoms of a gallbladder attack, list the testing used to diagnose gallbladder disease, be able to discuss the available options to treat gallbladder disease, and explain the recovery process post-surgical intervention. So here's a little anatomy for you. Your gallbladder is located right under your liver. So here's your liver, and then your gallbladder is adhered right underneath it. You can see a little bit better over here. Then you also have the ducts. So you have your common bile duct and your left hepatic duct. So the main purpose of the gallbladder is just to store bile. There's really not much other purpose of the gallbladder, but the bile is very important as it helps to break down fats. The bile is made in the liver and it is stored in the gallbladder. So signs and symptoms of gallbladder disease. Sometimes also called the gallbladder attack. Severe pain or aching in the upper abdomen, a dull ache beneath the breastbone, nausea, vomiting, or indigestion, loss of appetite, sometimes low-grade fever, and sometimes there's even jaundice. The first three I have an asterisk next to because those are ones that typically occur after eating a high-fat meal. Typically, there are several tests that are run to diagnose for a gallbladder disease: ultrasound, CAT scan, HIDA scan, and ERCP, which we'll learn more about right now. So this is an ultrasound machine. The wonderful part of an ultrasound machine is the results you get pretty quickly. It is non-invasive and usually little pain to the patient. So all an ultrasound is you can see this transducer, which is this probe right here. The transducer is placed on the abdomen and bounces a high-frequency sound waves off structures in the belly. So here's an ultrasound of a normal gallbladder right on this side, and then you see a gallbladder with gallstones on this side. And I say typically not painful. The test itself is not painful, but sometimes that transducer is placed over an area that is painful, so when patients may complain of pain just because they are having a gallbladder attack. This is CT scan, otherwise known as computed tomography scan. It is also a non-invasive test, so that is wonderful for the patient. It uses a series of x-rays to show detailed aspects of your body. And you can see here another part of when we were talking about anatomy earlier. Here's your liver, and adhered right underneath it is the gallbladder. And unfortunately, this gallbladder looks like it has cancer and a stone in it. Then we have a HIDA scan, also known as a hepatobiliary scan. This test does become a little bit more invasive as it does you need an IV. There is use of radioactive fluid that is injected through that IV. It's used as a marker to check gallbladder function. This test shows the filling and the emptying of the gallbladder to check to see if there are any bile ducts are blocked. Typically more accurate than an ultrasound, but it is also more invasive, as we just stated. Normal results would expect that you would see the radioactive fluid in the small intestines in about an hour. If it's not there, then that typically shows that there is a blockage of one of your bile ducts. Then we have an ERCP, an endoscopic retrograde cholangiopancreatography. So this one is the most invasive test of the ones we will be discussing. And this is basically a thin, flexible endoscope. Goes from in your mouth and is guided down to the stomach, to the common bile duct. This scope can find stones, and the wonderful thing about it is it can also remove them. So you see, there's my little cursor. These little probes can release it's almost like a basket, and it can retrieve the stones. Sometimes after surgery you might have a stone stuck in a bile duct, so you're able to go back through, do this again if you just need to get that stone removed. And stones, gallstones in and of themselves aren't the problem. The problem is when they become caught in the ducts, or they can also irritate the lining of the gallbladder, which can cause cholecystitis, and typically you would need antibiotics to treat that, and also again that can just cause pain and discomfort for the patient. All gallstones are is crystallized bile, so that just becomes hardened. So there's really nothing that gallstones themselves that they are a problem. So you went through all the tests and you found out that your patient does need to have their gallbladder out. There are 2 ways to get that done. The preferred method is laparoscopy versus laparotomy. Laparo here, our root word means abdomen, and scopy here is camera or scope, obviously, and otomy just means open. So you can see, oh, excuse me, go back. Okay, you can see here is an open surgery incision, so it's much larger. Typical laparoscopy is you just have these 4 incisions here, umbilicus, subxiphoid, and off to your right. And now they're actually even starting, I shouldn't say now, for a couple of years now, they have been doing Da Vinci robotic surgery, where everything is performed just through your umbilicus. So through your belly button, you can have the procedure done, everything work through there, and then obviously the scarring is much less. I do have a video on the next page that is kind of explains Da Vinci robotic surgery a little bit better than I can. Sorry for my ancient computer here.
I'm Dr. David Laurier. In this video, I'm going to be discussing a major breakthrough in surgery. This procedure, Da Vinci robotic single-site cholecystectomy or gallbladder surgery, is a major advance in the evolution of surgery. This allows safe, precise, outpatient gallbladder removal through a single hidden incision deep in the belly button with, in many cases, virtually no visible scar. Instead of the traditional 4 cuts that we would use in laparoscopic gallbladder surgery, or worse, the large, open, muscle-damaging cut under the rib cage that we would use in open gallbladder surgery, we are now able to use 1 single incision, and through that incision we can introduce multiple specially designed instruments. These instruments are now actually curved, and they cross or intersect each other in an X configuration. That crossing of the X is exactly where we put our incision. On the inside of the body, the tips of the instruments are now spread well apart from each other.
And you can see here's the liver and then the gallbladder.
Enhanced triangulation and safe exposure so that we can do the gallbladder surgery. In addition, we have enhanced high-definition 3-dimensional vision through the specialized robotic scope. I expect wide expansion of this technology to multiple areas of surgery as this robotic surgery revolutionizes the way I operate on people.
Okay. Get out here. Okay, presentation, sorry about that. But you can see the surgeon will actually set up the arms for the surgery, and typically a physician's assistant will stay on site. But then the surgeon actually goes off-site and, well, still within the room, but off the sterile field, and does all the surgery through those manipulations. Then we have the recovery from a gallbladder surgery, and it varies widely depending if you have an open surgery versus laparoscopic surgery. After either surgery, it is normal to have pain. Obviously, if you have an open procedure, you will have more pain. Doctor will prescribe medications. They often recommend that you take pain medications in conjunction with acetaminophen and ibuprofen to help dull the pain. Problems with taking too many opioid narcotic prescriptions are that it can also cause constipation, and then we're in an opioid crisis in our country right now, so we're prescribing less and less narcotics if possible. It is normal to feel tired and to see bruising around these sites. So you can see in this abdomen right here, you can see some old bruising. That is all normal. And those sites, they are a little bit reddened, but that's right around the incision. That actually look really good. Return to work, that just really depends upon the type of surgery you have. If you have a laparoscopic procedure, sometimes you can go back in 5 to 10 days. If you have an open procedure, that might take 4 to 6 weeks. And again, that also depends on what you do for a living as well. So that's something you would discuss with your doctor. You would also want to eat healthy meals. There's nothing really, no diet per se that you need to follow, but it's recommended that you start slowly with adding fats into your diet, because you don't have that bile anymore to help break down all of those fats. And then you want to resume your activity slowly. With any type of surgery, you just kind of want to go and kind of rest a little bit here. Basically, you just need to watch yourself. As you return to activities, your pain level may increase some, but just if you're going through the activities, if you're resuming your activities, just start it slowly to help reduce that pain. When you should call your doctor. If anyone post-surgical, this pretty much goes for anyone post-surgery, but since we're talking about gallbladders here, if you have a fever of 100.4 or greater, if you have new or increasing pain, if you have increasing redness or drainage from the incision, as I pointed out earlier, I showed you that incision, that redness, that is normal. You're going to have some redness when you see the redness kind of spreading from that. If you have nausea or vomiting that lasts greater than 12 hours, if you're experiencing any shortness of breath, if you're having any pain or swelling in your calf, kind of looking for a DVT, which you can see right here in this picture. You see that redness, that swelling in this calf. That's you'd be looking for a DVT there. Symptoms of jaundice, light-colored stool, dark urine, yellowing of skin or eyes, which you can see wonderfully up here. This is the perfect example of jaundice. And you can also experience severe diarrhea. So here is our case study. What I'd like you guys to do is we'll kind of start this together and then finish this up in your discussion board. So you have Christina. She is a 46-year-old female who comes to the emergency department with abdominal pain, sweating, indigestion, nausea, chills, and diarrhea. What other questions would you have for this patient? There's different things. Again, we could ask her what she's been eating, seeing if, her meals had anything to do with this, if how long she's been experiencing this, things like that. What other questions do you have for this patient? What tests would you like to have done? What would you like to do to kind of decide what's going on here? And so it's this is like a choose your own adventure type thing. You want to answer these questions in this week's discussion board and make your own ending to the story. There is no right or wrong answer here as long as you can back up your thoughts with information learned from your prior readings and today's lesson. So basically, just because you may have one ending, your peer may have a different, and that's fine. And I kind of hope to see a little bit of variance in there. Did somebody do right away from the HIDA scan, or no from this, or what test did you do? Did they have to do the surgery? Did they try to just kind of watch for a little bit? What happened there? Did they have any complications afterwards? Again, if they had the laparoscopic procedure, if that's what happened, or a laparotomy, what was the recovery time? Kind of expand upon that. So as you finish that, I want you then to respond to two of your peers. Is there anything that you would have done differently than your peer? Again, there's nothing right or wrong, but I kind of want you guys working together, put your heads together to see what you did. Okay, if you guys have any questions for me, again, I'm always open. Please send me an email, and I will get back to you as soon as possible. I look forward to seeing the discussion boards. Thanks so much, guys. Bye.